Good morning, guys. I hope y'all are doing well. Are we ready to answer some thyroid and hormone questions or what? I'm trying to also go live on Facebook, and it is the least user-friendly. Aw, thanks, Mars Eyes. It is the least friendly thing. What do you mean start screen share? No. Close. So, if you guys don't know who I am, I'm sorry, I'm like multitasking right now. If you guys don't know who I am, I'm McCall McPherson. I'm the founder of Modern Thyroid Clinic and soon to launch Modern Weight Loss. And I come on live with you guys and answer y'all's questions. Why will this not let me go live? Okay. So, how's my eczema from the other day? Oh my gosh, you're so sweet. It's actually better than it was last night, yesterday. Like, it's so strange, but it shows up like directly related to stress. Okay, I'm gonna go back and just tell these people that it literally will not let me go live. Yeah, no. So it's better. Like, I've been literally working. Oh, I don't have one on this side. I've been working on it for all day last night. Okay. I've got skin tags showing up that I've never had before. Is this from thyroid? You know, skin tags are not a common thyroid issue. It's not to say that it can't happen, because it can. But I don't think that's thyroid related. Let me just post on Facebook really quick and tell them. So, Facebook isn't letting me go live. If you want to find me, I'll be live on TikTok, and then you guys will have my full attention. And I'm sorry to be a pain. Well, my full attention while I get ready. So someone said, I've got skin tag. Okay, yes, skin tags are due to insulin resistance. I think that's very possible for sure. I definitely usually something that shows up long before skin tags is like darkening of your neck area. Thanks for the follows, you guys, especially because I haven't offered really much of anything so far this morning. So, usually this starts pretty chill. I think it will be reasonably chill today because a lot of times whenever I go live on Instagram and Facebook. I mean, Instagram and TikTok. Facebook sucks. It's the worst, honestly. So I'm usually kind of divided in my attention, but today it's just you guys. So if y'all have any questions at all about thyroid, shoot, because once more people hop on, it tends to get a little bit crazy. I just got a letter to go for my pre-op to have my right thyroid removed. Already had the left one out. That is not fun, especially because post-thyroidectomy people, y'all, they struggle. It's a sad deal. So I'm curious why you're getting your thyroid out. Can thyroid cause elevated liver enzymes? Absolutely. Oops, I still had do I have my eye patch on? I do. The eye patches that I use, you guys, are the best. I don't have them in here. Oh, I do. COSRX, snail, mucin patches. They literally calm my eczema so much. You can barely see it. I guess maybe someone followed me on Instagram that's here this morning, because I only posted that on Instagram. If y'all don't follow me on Instagram, I share more personal things. I poll you guys today I'm meeting with our health coach to record content about GLPs. She's specifically our health coach for our weight loss program. She's amazing. Her name's Sally. So if y'all have any questions, I have on my Instagram story, like ask me anything. We're going to do obviously a lot of talking today about generalities of GLPs, especially for thyroid people. But we're going to do rapid fire answer questions. Circling back to, can thyroid issues cause elevated liver enzymes? Yes, absolutely. So hypothyroidism can cause fatty liver. So it causes increases in cholesterol, blood sugar, all of these things that can lead to fatty liver, which can, in insulin resistance, which can drive your liver enzymes up. Also important to know, liver enzymes are dynamic. They change. Like if you have a glass of wine 2 days before, they'll increase. If you have Tylenol a week before, they'll increase. Can you have Hashimoto's and still have a successful pregnancy full term? Absolutely. No questions asked. I mean, I do think that you should get your thyroid sorted out adequately in terms of your thyroid function. Hashimoto's in pregnancy usually actually goes into remission. Our body suppresses our overactive immune states when we're pregnant so that it protects the baby. Do you recommend to biopsy nodules that haven't grown in a few years? No, not really, unless they're very large. And usually the American Thyroid Association doesn't either. I'm gonna put in eye drops. Sorry guys, we're like getting personal today, which is not uncommon for me and you and TikTok lives. I always do, like, I'm always way more personal on these things. I've had a partial thyroidectomy over a year ago because cancer, and I felt awful ever since. So this goes back to, I think she's speaking to the person who's slated to get the other part of her thyroid removed. Life post-thyroidectomy is very difficult. It's not fun. If you don't need to have your thyroid removed, guys, don't get your thyroid removed. If you do get your thyroid removed, as soon as humanly possible, you find someone that actually knows what they're doing to help you. I had mine removed in February and I'm still struggling. The sooner y'all get to someone who can help you post-thyroidectomy, the more likely it is that you will get your life back. The longer it takes to find someone, the harder it is for us to get you your life back. I was gonna use one other cream on my eye eczema, and I don't think I brought it up, which sucks because, again, I'm doing a bunch of recording today. Can't lose weight either. Depression has set in. So let's talk about weight loss with thyroid issues. A lot of you guys are asking about this. So obviously the foundation is fixing your thyroid. And people think sometimes, oh, if I fix my thyroid function, if my medication is balanced, if everything looks good, I'll be able to lose weight. It'll just fall off. And that is not actually what happens at all. So when you have a thyroid issue, your body becomes less metabolically potent over time. And the longer you have that thyroid issue, the less potent your metabolism is. If I wave a magic wand today and all of your thyroid issues are perfected, your Hashimoto's is in remission, your thyroid medication is perfect, you do not instantly lose weight. So, thank you for the hearts. Yes, y'all, please give me some hearts to let other people know that we're here and like hanging out to alert them. The reason we don't instantaneously lose weight is because we have to rehabilitate our metabolism. It has lost its efficiency. And most commonly, even with effort, it's very difficult to lose weight, much less like people think that weight is just going to fall off, you know? So you have to, of course, foundationally fix your thyroid. Then you have to rehabilitate your potency. So that's improving insulin sensitivity. That's improving your blood sugar metabolism. It's improving your leptin resistance, all of those things. And here are some ideas of things that I use with my patients at Modern Thyroid Clinic to help with that. Oh, thank you. So number one, intermittent fasting. Intermittent fasting is an extremely powerful tool to reverse the damage metabolically that hypothyroidism causes. I have an in-depth a video from a couple weeks ago on my page that tells you guys exactly how I fast and how I recommend my patients with thyroid, hormone, adrenal issues fast. The key is not being a crazy, rigid, dogmatic person about it and doing it super long fasts every day of the week. So, another great one is ordering your food throughout the day, meaning keep protein first, green leafy veggies, low carb food first in every meal and your earlier meals in the day, breakfast, lunch. Save your carbs and sugar for the evening so that you keep your insulin as low as possible, as long as possible. Kind of like intermittent fasting, by working particularly on your insulin. Another one is metformin, guys. Like metformin, yes. Is it a diabetes drug? Absolutely. Can it help reverse the metabolic damage that hypothyroidism causes? Heck, yes, it can. Can it also help interfere with a lot of cancer pathways and reduce aging, the aging process? Yes, it can. And lastly, you guys know what I'm going to say, right? For weight gain, weight retention, inability to lose weight with effort for people in general, but especially people with thyroid issues, GLP-1 weight loss medications, y'all. That is why, that's one of the reasons why I am so passionate about them, because they are effectively the most potent and powerful way to heal metabolic function that's been damaged due to, in general, but especially due to thyroid issues. Crazy powerful. And that is why we are starting Modern Weight Loss. We've been using these meds in our clinic we're on 3 years now. We've gathered so much data, predictability. We've nuanced our program to perfection. Now we're going to take it nationwide. What was that? A GLP? What is that called, GLP? Oh, yeah. So, I always forget that sometimes not everybody knows what these meds are. So GLP medications are the newer class of weight loss meds. Mounjaro, Ozempic, Wegovy, tirzepatide, Zepbound, those class of drugs. They are drugs that have multiple influences in your physiology. They do so much more than create weight loss. They can heal metabolism. They can influence cancer risk. Good morning, Sarah. They can protect you from Alzheimer's and dementia, heart attack, stroke, which is the #1 killer of people in our country. They won't let me take a GLP because my BMI isn't high enough, even though I can't lose weight. Right. So you can find like other programs that don't make you hit an obese BMI. There's a lot of them around. They're all based on compounded meds. Insurance won't approve drugs for people who don't meet that BMI requirement. But honestly, I prefer compounded, like good compounded meds to brand name GLPs anyway. Do I recommend GLP-1s for patients who've had cancer? Like what kind of cancer? GLPs are being studied as adjunctive cancer treatment to improve outcomes. So the only types of cancer that GLPs are contraindicated in are medullary thyroid carcinoma, specifically that type of thyroid cancer, not other types of thyroid cancer, and multiple endocrine neoplasia. Other than that, the world is your oyster. And that is for in an overabundance of caution. How long should we wait to eat, etc., after thyroid meds when on tirzepatide? I know. So, I see in about 8 to 10% of our patients that the delayed gastric emptying, your food sits in your upper GI tract longer, influences thyroid medication. And so what I tell people is obviously in the morning, take your thyroid medicine before you eat. Wait at least 30 minutes to eat after. In the afternoon, if you take a double dose and you're eating lunch and then taking your second dose, I tell people to wait at least an hour and a half, ideally, bare minimum an hour after they eat to take their meds. You're welcome. My TSH was normal, but my T4 was low. What do I need to do? Should I be concerned? I mean, you don't need to be concerned, but it does need to be addressed. You should not be walking around with low T4. That means likely you also have low T3 unless you're on a T3 based medication. So it's something that I do believe you need to intervene on for sure. Can I be on LDN and a GLP? Abso-freaking-lutely, you can. It's a fantastic combination. Love it. What about papillary carcinoma? So everything is, about risk versus benefit, right? So, and every person has to weigh that for themselves. That is a patient decision. That is not a clinician decision. That's part of our problem with healthcare. We strip away the authority of a patient to make their own health decisions when you guys should. That is your thing. It is your body. So I just take people with a history of papillary carcinoma through risk benefits alternatives, talk with them about it. If it were me, I would 100% take it with a history of papillary carcinoma. I have multiple patients in this case that are on it, and some of the top thyroid people that treat thyroid cancer also agree with me. Honestly, y'all, GLPs, I'm gonna be real with you. GLPs, even for medullary thyroid carcinoma and multiple endocrine neoplasia, they are not showing real risk in human studies. They showed risk in rat studies because rats were on a much higher dose of GLP, and they have 100 times the receptors in their thyroid, GLP receptors. So they were flooded with all this extra GLP. Their thyroid has all these receptors, and so it became a concern in rats. It is not translated to human studies. In fact, GLPs have less risk of thyroid cancer than insulin. And you know what? Insulin doesn't carry a risk for thyroid cancer. So a lot of this is being hyped in the media inappropriately. Do I recommend eliminating gluten and dairy? So for Hashimoto's, right? Hashimoto's is driven by inflammation. For those of you who are new around here, it is absolutely possible to reverse Hashimoto's. Yes, give me all the likes, you guys. Let people know that we're here. Give me all the hearts. So Hashimoto's can be reversed. It can be put into remission. My personal Hashimoto's has been in remission for over a decade. Countless patients of ours at Modern Thyroid Clinic have gotten to remission. So it is treated by trying to, thank you for the hearts, y'all, by trying to influence inflammation. And obviously a powerful way to reduce inflammation is through our diet, because we have control over that. We don't have control over our genes, right? So, dairy is the number one most common food inflammatory response that I see with testing. I know everyone talks about gluten. Gluten is number two, but honestly, number one is dairy. It takes the cake. So I recommend that people, if you want to go gluten or dairy free, you choose one. Do that for 3 months. You check your antibodies, TPO and thyroglobulin, before you start gluten-free or dairy-free diet, and then three months later to see how your antibodies have responded. I can't find my damn eyebrow pencil, and I don't have any eyebrows, guys. I don't have eyebrows. They're so tiny, and it's not even from over plucking in the 90s. I just don't have eyebrows. They're so blonde. On GLP, okay, got that one. So technically for insurance, you guys are asking about the BMI requirement for GLPs. Technically on insurance-based model, you have to have a BMI over 30, so you have to be obese, or a BMI over 27 with one comorbidity. And there are a lot of comorbidities: elevated cholesterol, elevated insulin, pre-diabetes, diabetes, high blood pressure, any form of heart disease. I think even loosely you could say depression. What are the other ones? There were some newer ones added. Anyway, you get the picture. So it becomes a little bit more flexible, and they're trying to make it more flexible, which they should. Everyone should have access to these medications. Full stop. You're welcome. Have you heard of Hürthle cell carcinoma? For sure. For sure. I am not an expert in that whatsoever, but I've definitely studied it. I feel like I've had 1, maybe 2 patients with it. So I can't say a whole lot. How is PCOS linked to Hashimoto's? So PCOS can definitely be linked to hypothyroidism. So early indications that you have a thyroid problem are elevations in your blood sugar or your cholesterol. Obviously, PCOS is very interconnected with blood sugar and insulin resistance, as is hypothyroidism. And I mean, whenever I was 27 and going through my own thyroid crisis, the doctor told me I needed like cholesterol medications. I was like literally 27. My cholesterol issue is 100% due to my thyroid problem. So very, very interrelated. And then if you can fix your thyroid and then work to reverse that loss of metabolic potency, it can improve. Can GLPs reduce hypothyroidism? GLP, I love that y'all are so interested in GLPs. If you just joined, please do me a favor. I'm recording long content for y'all today on GLPs. We're launching our podcast on September 30th, Modern Thyroid and Wellness. I'm so excited, but I'm recording a podcast interview with our health coach, who is like a huge part of our program and has been, our weight loss program. And we are talking today, and I want to be sure and answer all y'all's questions. I have an Ask Me Anything on my Instagram story that I would love for you guys to go and ask questions that you have, like that might require a little bit longer content and explanation. That's often where I do these. I